Osteoporosis is a condition in which bones gradually lose their strength. What begins deep inside the body often remains unnoticed for years. The internal structure becomes porous, the fine bone framework thins out, and stability decreases. Most people feel nothing at first because osteoporosis causes no pain until a fracture occurs. In healthy bone, cells constantly renew themselves. Old tissue is broken down, new tissue is built. In osteoporosis, this balance is disrupted. Breakdown becomes faster, rebuilding slows down. The result is a skeleton that looks normal from the outside but is weakening from within. Older adults and women after menopause are particularly affected, as hormonal changes influence bone metabolism. But lack of exercise, vitamin D deficiency, low body weight, and certain medications can also increase the risk. The consequences often appear after a minor fall, a vertebra collapses, the hip fractures, or the wrist breaks. What seems like a simple accident is often the first visible sign of a long-developing disease. Osteoporosis is not a rare condition but a silent companion of aging, and that is why understanding it early is so important. Before a bone fractures, the body has often undergone years of silent changes that remain unnoticed from the outside. Osteoporosis does not appear suddenly, it develops slowly and quietly. Inside the bone lies a delicate framework of tiny structures that give it strength and stability. Over time, this framework becomes thinner, the spaces grow larger, and the bone loses resilience. A bone that once tolerated pressure and impact without difficulty becomes more fragile, long before any symptoms appear. Early signs such as back pain, a slight loss of height, or a gentle curvature of the spine are often attributed to aging. Yet this is exactly where the silent nature of the disease becomes visible. A vertebra can collapse without any major accident. Lifestyle also plays a significant role. Too little movement, insufficient sunlight, an unbalanced diet, or long-term medication use can further weaken bone metabolism. The body needs nutrients and regular activity to maintain strong bones. Osteoporosis is therefore not merely a condition of old age but the result of many factors accumulating throughout life. Understanding how the bone changes is the first step toward taking action early. Osteoporosis is often described as a condition of older age, yet in rare cases it can appear during childhood or adolescence. When bone metabolism is impaired from the beginning, the skeleton does not develop the strength it needs. For families, this diagnosis can be overwhelming, because the idea of a young person living with fragile bones feels frightening. Some children are even told early on that their bones may not withstand the rapid growth of youth. But such predictions are not always final. There are cases in which children with severe forms of the disease have grown into adulthood by learning to move carefully and avoid unnecessary strain. This shows how individual the course of osteoporosis can be. While adults mainly struggle with bone loss, young patients face the challenge of building enough bone mass in the first place. Every movement, every activity, and every daily decision can influence their stability. At the same time, the experience of many families demonstrates that medical forecasts are not absolute. With proper care, an adapted lifestyle, and a cautious approach, even severely affected children can live far beyond what was once expected. Osteoporosis is therefore not limited to older age. It is a condition that can accompany people at any stage of life, sometimes quietly, sometimes visibly, but always with a deeply personal story. For parents of a child with osteoporosis, daily life becomes something few outsiders can truly understand. While other children run, play, and explore without limits, they must explain to their own child why these simple joys are too dangerous. How do you tell a young boy that he cannot ride a bicycle, even though all his friends do? How do you explain to a little girl that a swing is off limits, even if it would bring her only a few minutes of happiness? And how do you tell an energetic child that playing football could put his bones at risk? These conversations are painful because they go against everything a child naturally wants. For the parents, it means constant vigilance. Every step, every movement, every moment carries a potential danger. They sleep more lightly, listen more carefully, and react more quickly. It becomes a life in which one can never fully relax. Added to this are countless doctor visits, examinations, check UPS, and discussions with specialists. Appointments that demand time, energy, and emotional strength. Many parents describe these years as a mixture of worry, responsibility, and the desire to give their child as normal a life as possible despite all limitations. And yet, experience shows that love, patience, and constant attention can change the course of a life. Some children who were once given only a few years survive into adulthood because their parents were there for them day and night. Childhood osteoporosis is not only a medical challenge but a test of endurance for the entire family, and a quiet reminder of how strong parents can be when their child needs them. Medicine has made significant progress in recent years, especially in the treatment of osteoporosis. In the past, doctors often reacted only after a fracture had occurred. Today, the focus is on early detection and targeted prevention. Modern medications can slow down bone loss or even stimulate new bone formation. Some drugs block the cells that break down bone, while others support the cells responsible for building it. Bone density scans have also become far more precise, allowing doctors to monitor changes more accurately. Artificial intelligence now plays an important role as well. It can analyze X-rays and bone density data faster and more precisely than the human eye, detecting patterns that might otherwise be missed. In some clinics, AI even evaluates movement data to predict the likelihood of falls before they happen. But medicine alone is not enough. The body needs specific nutrients to maintain strong bones. Vitamin D is essential because it helps the body absorb calcium, the main building block of bone. Vitamin K2, magnesium, and protein also support bone metabolism. Nutrition is equally important. Foods such as broccoli, spinach, almonds, oats, yogurt, cheese, salmon, eggs, and legumes provide valuable nutrients. Fruits like berries, apples, and bananas offer vitamins without stressing the body. The best results come from combining medical treatment with sunlight, physical activity, and a balanced diet. Modern medicine can do a great deal, but it works best when people actively support their own bone health. Osteoporosis often develops quietly, yet it can affect anyone. The earlier we understand how to protect our bones, the better we can prevent long-term damage. If this video was helpful to you, consider subscribing so you won't miss future health documentaries. Thank you for watching, and stay healthy.